So your liver is like this big sort of reddish-brown organ that sits on the right side of your belly, right above your gallbladder, your stomach, and your intestines. And it's made up of these special cells called hepatocytes, which have a bunch of super important jobs for your body, like metabolizing or processing nutrients, making bile, which is, everyone's favorite fluid, and also helping remove toxins from your body, or detoxification. And these hepatocytes can die in a condition known as hepatitis. If we break down this word, hepatitis, into two parts, you've got hepat, which refers to your liver, and then itis, which is what we usually tack on to the end of something when we want to refer to inflammation. So when you hear the word hepatitis, basically it means there's some sort of inflammation going on in the liver, which is ultimately caused by the death of these hepatocytes, or liver cells. One way hepatocytes can die is by necrosis, which is death due to some kind of trauma or injury. So, like for example, necrosis can happen when a cell doesn't get enough oxygen. The other way they can die, though, is by something called apoptosis, which is programmed cell death, meaning that it's like this controlled or regulated process that leads to cell death. Usually these cells are told to undergo apoptosis through some sort of signaling by the body. The two most broad forms of hepatitis, or inflammation and death of liver cells, are acute and chronic hepatitis. Acute is when it lasts for 6 months or less, and chronic is just when it lasts for longer than 6 months. Chronic hepatitis can last for decades of someone's life even. But how do we know if someone has hepatitis? Well, that's a great question. Sometimes it's super tough to know, since someone's condition can vary from being totally asymptomatic, meaning that they don't have any symptoms at all, to having a bunch of different symptoms. And when they do have symptoms, sometimes people aren't even aware that they have hepatitis, because the kinds of symptoms they experience can be similar to the flu. These sort of general symptoms are called nonspecific symptoms, because they aren't specific to just hepatitis. Some of these symptoms might be things like fatigue, nausea or vomiting, and fever. In some cases, though, someone might experience symptoms more specific to hepatitis, like yellow skin, which is also called jaundice, darker colored urine, anorexia, enlargement of your spleen, and accumulation of fluid in your abdomen. If hepatitis becomes chronic or more severe, it can lead to other complications like cirrhosis, which is this point when your liver gets scar tissue and doesn't function like it should due to long-term damage. Chronic hepatitis can also lead to total failure of the liver to function and can even cause liver cancer. So these are definitely not good things, right? Clearly we want to avoid getting hepatitis. But how do we even get it in the first place? Well, the most common cause of hepatitis is from some kind of virus that targets and damages the liver cells. And there are quite a few different kinds of viruses that do that. And that's why you've probably heard things like hepatitis A or hepatitis C or even hepatitis E. These are all different kinds of viruses that lead to different forms of hepatitis. Hepatitis doesn't have to be caused by a virus, though. Another way one might get damaged liver cells is through chronic alcohol consumption. This is because the vast majority of alcohol is sent to the liver to be processed. The alcohol is then converted into a compound called acetaldehyde, which is even more toxic to the liver cells than the alcohol is. The alcohol, acetaldehyde, and other metabolites cause the liver to be inflamed. In other words, you develop hepatitis. Finally, the last way someone can get hepatitis is as an autoimmune disease. And this process is not as well known, but basically it means that your own immune system starts to launch this attack against the hepatocytes, or your liver cells, even when they're seemingly normal, which results in cell death and inflammation of the liver. Knowing whether the hepatitis is being caused by a virus, alcohol consumption, or as an autoimmune disease is super helpful for treatments to be effective and for patients to get better.